Botox, Botox, Botox. Seems everybody is using it for some purpose or other. And most commonly, of course, we use it to soften frown lines and creases and facial expressions. But there's a whole world of other areas where this can be used too, and we're only limited by our creativity, and many of our other specialties do as well. Armando, what have you seen in terms of other clever uses for Botox? How can it help people?
Well, if you understand that Botox relaxes muscles, you really can be very creative with it. We were talking earlier that one of the ways that we use it in plastic surgery is to soften the jaw muscles here.
Right.
Patients grind their teeth. Sometimes that muscle can get a little big and make the face look less feminine. Is that something that you're familiar with, Dan?
Yeah, I do it a lot. I think it's very helpful for TMJ. The patient just has to understand that they'll lose volume in their jaw.
But sometimes that's the goal. Right?
Sure.
Absolutely.
And I know that some of our other colleagues in other specialties use it for spastic muscles in other parts of the body too.
Absolutely. Anytime there's an issue, and some of the people are, very skilled and very advanced techniques. What are some of the other things you've seen, Dan, in terms of Botox?
I'll inject it in people's armpits for excessive sweating.
Yeah, they're great. Patients are so grateful for that.
So that's very effective, right?
Yeah, and you can, people that have sweaty palms, tremendously useful, but that hurts, so you got to figure out ways
So just like anywhere else, the Botox will wear off, but it controls the sweating really well for a while.
That's the other thing, and it can really make a big difference for people. So I think we should be careful, though, as plastic surgeons, to always think about what's best for our patients. And I know there's a phenomenon called Barbie Botox right now. Any thoughts on that?
Yeah, so girls sometimes feel like their shoulders are a little too big. Their trapezius muscle is overgrown. So they want to soften that with Botox. I do it sometimes. What I tell patients is if you get migraines, it could get worse. A lot of times migraines are from the muscles in the back of the neck being too tight.
Right.
And there's some kind of mechanism there where...
So you're injecting Botox into this muscle here to kind of flatten it out, makes the neck look longer. And
I personally would advise caution on that one, because I think it's a really complicated system, and you don't want to make a person worse or suffer unintended consequences.
Yeah, just like anything else, I think that Botox works best when you're correcting a problem than trying to change something that's normal.
And beware of social media influencers. That's not the best way to choose your doctor.
Right.
Well, it's a fascinating topic, and for more information like this, please go to the plasticsurgerychannel.com.